I mentioned that they went to each specialty society and now have many, many, and if you haven't seen these sheets, there are resource links in these slides at the end. But if you go to the Choosing Wisely site, there are these 5 things list, right? So virtually every specialty society, starting with primary care, I think American Academy of Family Physicians has 3 or 4 or 5 sets of these 5 things. So they've got 15 or 20 things. And ABIM, again, very smartly put it in terms of not things you shouldn't do or should never order or patients shouldn't get, but they said 5 things physicians and patients should question, right? So you can see some of these not so well, but don't do imaging for low back pain within the first 6 weeks. Long-standing guideline and recommendation, right, about avoiding testing early in the course of low back pain, because most low back pain will end up being not having serious clinical implications, and most will resolve within 6 weeks. So again, every specialty society coming up with lists like this that are based on best evidence with expert opinion, and really trying to get at what are some of the most common tests, procedures, treatments that should, again, be questioned. Go ahead. They really did, ABIM left it to each specialty society. So I think it is acknowledged that there are varying degrees of how useful some of these recommendations are. And I think some have reasonably asked, well, are the specialty societies really going after things that maybe generate revenue for them? And I will agree that it's the recommendations are variable, but I think on the whole, really do create a whole set of opportunities to prompt clinicians and patients to ask these questions that can very much add to the distinction and value of recommended tests and treatments. Go ahead. In addition to that, I mentioned the partnership with Consumer Reports. So in addition to coming up with the 5 lists, the list of 5 things from the provider side, again, ABIM then partnered with Consumer Reports to say, well, how do we translate that into patient language and information? So partnered with Consumer Reports to create a whole set of these various patient info sheets, which are typically 2-sided sheets, 1 page. I think, again, there's been some feedback, critique that language levels can be a little bit high. So I think Consumer Reports has tried to go back to some of those and create a more low literacy or readable version. So I'm sure always still work to be done, but a very, very helpful set of resources and tools for providers to have access to be able to share these patient information sheets with patients. And again, if you go to this link, Consumer Health Choices, just dozens and dozens of these patient info sheets. Go ahead. In addition, Consumer Reports has created other tools, including the smartphone app. You can see, and if you go to iTunes and do a search for Making Healthy Choices is their title for it, you'll find this. And I think importantly gives access to the general set of 5 questions, which we'll talk about in just a minute, but also allows for a search. Because again, part of the challenge here is there's so much information out there. How do you focus on, how do you find the information at the point of care when you need it? So I would encourage you all to go and download the app and try it out.